Hi, I'm Susan Hoagland. I'm Executive Vice President of the California Academy of Family Physicians. And before I turn to the very important action of the Supreme Court last week, upholding the ACA, I want to address two important CAFP bills that will be heard in the Assembly Health Committee on July 3rd, SB 393, our bill to define the patient-centered medical home, and SB 1416, our graduate medical education funding through health plan voluntary contributions bill. If your Assembly person serves on Assembly Health, we'd be very grateful if you would ask him or her to support both of these bills and to let us know you made that contact. Past President Carla Kakatani is going to testify on CAFP's behalf on both bills. Last week we spent a good deal of time before Thursday further developing our 2013-15 CAFP planning retreat weekend on July 28-29, completing some environmental scans on advocacy, practice transformation, and healthcare workforce to further educate our participants about each of these areas of focus. Also last week we had a very productive conversation with yet another medical group that might be interested in a PCMH transformation project similar to our project in Fresno. I also participated in a call with the California Association of Physician Groups about the possibility of establishing a sort of advanced primary care institute to promote the medical home and medical neighborhood in the state. Our legislative advocate Tom Riley was in there pitching until the last minute on the budget that went to the governor, and we're still sorting out the impact of the budget and the governor's further line item vetoes. And now to the Supreme Court decision. I'm sure that many of you were up and anxious at 7 a.m. on Thursday waiting to see what the decision would be, and we were actually very pleased and somewhat surprised at the outcome. We met early in the morning to talk with our media consultant Catherine Dyrene by conference call and established what tack we'd be taking in our press release. We emphasized that now we have the opportunity to continue moving healthcare reform forward. Our AAFP national office provided us with some tremendously good resources ahead of the decision, and it issued its statement commending the decision almost immediately. Ms. Dyrene had lined up media spokesperson interviews with members of the media around the state starting at noon on Thursday, so we quickly crafted both our press release and talking points, which are now up on our website, and got them out. Our president, Steve Green, was interviewed on the NBC station in San Diego, and he did a great job. The San Diego Union Tribune also quoted Dr. Green, and other FPs around the state, Adriana Padilla in Fresno, Michelle Kyogi in Bakersfield, Peter Broderick and Del Morris in the Modesto Bee, Sharon Lynn and her young son Hudson in the Marin Independent Journal, and we still have the possibilities that Asma Joffrey and Carol Havens will be quoted in their local papers. Our focus on these comments was that patients will benefit now. Healthcare delivery models and coverage will improve, and now we really do have to address the primary care physician shortage to make all of this work. California is fortunate that we're far ahead of the curve on the work of our health benefit exchange. The Healthcare Endowment of California had an interesting full-page ad in the San Francisco Chronicle, possibly in other papers as well, talking about the many benefits of the ACA up to now. That includes the children who are up to age 26 who are now covered by their parents' health plans, eliminating lifetime caps on benefits, not denying insurance for pre-existing conditions. The endowment projects that 92% of Californians will have some form of health insurance by 2014. This is good news for Californians, and these are good things. So we acknowledge certainly that the ACA is not perfect, and we have a lot of work to do to fix some of the problems now that it's been upheld. But we know what we're up to now, and we will work hard on behalf of our members and their patients to make it a better piece of healthcare reform. Thank you for listening. I'm Susan Hoagland. Hope you have a great week and a great 4th of July holiday.